Everything Is Tuberculosis is John Green's second nonfiction book, a compelling blend of personal narrative, scientific history, and social critique that examines tuberculosis, the world's deadliest infectious disease, despite being curable since the 1950s. Green, best known for young adult novels like The Fault in Our Stars and his YouTube channels Vlogbrothers and Crash Course, uses his platform to advocate for global health equity. The book centers on the story of Henry Reider, a teenage TB patient Green met in 2019 at Lakka Government Hospital in Sierra Leone, weaving it with the historical, social, and scientific dimensions of TB. Green argues that TB's persistence is not a medical failure, but a human one, rooted in systemic inequities and societal neglect. He writes, "Tuberculosis is so often, and in so many ways, a disease of vicious cycles. It's an illness of poverty that worsens poverty. It's an illness that worsens other illnesses, from HIV to diabetes. It's an illness of weak healthcare systems that weakens healthcare systems." The book is both a call to action and a meditation on humanity's capacity for compassion and failure. Green's central argument is that TB, caused by the bacterium Mycobacterium tuberculosis, is no longer primarily a biological problem, but a social one, perpetuated by human choices. He states, in a world where everyone can eat and access health care and be treated humanely, tuberculosis has no chance. The book's title reflects Green's realization that, in my mind, everything is about tuberculosis, and tuberculosis is about everything. A nod to how TB intersects with poverty, stigma, racism, and global health disparities. Structured as a narrative that alternates between Henry's personal journey and broader historical and social analysis, the book is accessible, under 200 pages, and written in Green's signature witty, empathetic style, likened to his Crash Course videos. It covers TB's impact across millennia, its romanticization in the 19th century, its modern association with poverty, and the urgent need for systemic change to eradicate it. The emotional core of the book is Green's friendship with Henry Reider, a 17-year-old Sierra Leonean with multidrug-resistant TB. Green met Henry in 2019 while visiting Lakka Government Hospital with Partners in Health, a nonprofit he supports. Henry, described as having spindly legs and a big, goofy smile, appeared younger than his age due to TB's ravages. His story, which Green reveals includes his eventual recovery, epitomizes the challenges of TB treatment in low-income countries. Henry's late diagnosis, malnutrition, and lack of access to personalized drug cocktails, readily available in wealthy nations, worsened his condition. Green writes, Henry's story is hopeful and heartbreaking. Readers will be rooting for him and his family the whole way through. Henry's mother's devotion and the efforts of a doctor navigating a broken system highlight the resilience of those fighting TB, however. Green notes the stigma Henry faced. TB is still a major health issue worldwide. Stigma around TB can prevent people from seeking help, which only makes the problem worse. Green uses Henry's narrative to humanize TB, showing how systemic barriers, high drug costs, inadequate healthcare infrastructure, and social marginalization prolong suffering. Henry's recovery, achieved through persistent advocacy and treatment, underscores Green's belief in virtuous cycles, where TB survivors can improve outcomes for others. Green traces TB's history, noting its entanglement with humanity for millennia. Once called consumption, TB was romanticized in the 19th century as a flattering malady that enhanced beauty and creativity. Green quotes Charlotte Bronte, who wrote as her sister died of TB, "Consumption, I am aware, is a flattering malady." Dr. Arthur Jacobson in 1909 claimed TB offered divine compensation, shortening lives but quickening poetic genius. This romanticization, Green argues, distorted perceptions, framing TB as a disease of refined souls rather than a public health crisis. The discovery of Mycobacterium tuberculosis by Robert Koch in 1882 shifted perceptions. Green details how racialized medicine initially claimed TB was a disease of civilization, affecting whites due to their supposed intellectual superiority, then flipped to blame Black Americans' smaller chest capacity when data showed disproportionate deaths. By the 20th century, TB became associated with poverty, crowded conditions, and weak healthcare systems. Green writes, "Kings died of tuberculosis." That's not the case anymore. Now it's a disease primarily affecting those who live in crowded conditions, those who work in crowded, poorly ventilated factories. Green explores TB's social determinants, emphasizing that contemporary TB epidemics are the result of human systems. Poverty, malnutrition, and coexisting diseases like HIV exacerbate TB's spread. He notes, because untreated HIV lowers resistance to infection, TB infections are far more likely to progress to active disease as the immune system weakens. In Sierra Leone, Colonial Legacies, railroads built to extract resources rather than connect communities, left a fractured economy that fuels poverty and disease. Green quotes Dr. Baylor Berry. "If you want to understand why Sierra Leone is poor, you must look at a map of our railroads." Scientifically, Green explains that TB is curable with a cocktail of antibiotics, but access is limited by cost and infrastructure. MDR-TB, like Henry's, requires complex, expensive treatments. Green's advocacy, including rallying his Nerdfighter fans to pressure Johnson & Johnson and Cepheid in 2023, lowered costs for bedaquiline and diagnostic tests. Yet he highlights ongoing gaps. "We don't have a great test for kids, for example, and we still don't know why some people develop active tuberculosis." A promising vaccine candidate and cheaper diagnostics were on the horizon when Green wrote the book. But funding cuts, including the Trump administration's defunding of USAID, have stalled progress. Health inequity. Green argues that TB's persistence reflects a failure to value all human lives equally. He contrasts his brother's costly cancer treatment, unquestioned as cost-effective, with TB patients denied affordable care. "We just do not treat all human lives as if they are equally valuable." Stigma and marginalization. TB stigma isolates patients, delaying diagnosis. Green notes, the stigma surrounding TB has dehumanized patients, often leading to their marginalization. Historical tropes, from romanticized poets to racialized blame, persist in modern biases, human choices, and responsibility. Green insists TB is a decision, not an inevitability. He writes, "We cannot save those we love from suffering." This is the story of human history as I understand it, the story of an organism that can do so much, but cannot do what it most wants. Collective action, like his $3.5 million fundraising for Partners in Health, shows change is possible. Hope amid despair. Despite systemic failures, Green finds hope in progress. The year you graduated from high school, 12 million children died under the age of 5. Last year, fewer than 5 million did. He sees advocacy as nudging the flywheel forward. Green's primary argument is that TB's 1.5 million annual deaths are preventable if societies prioritize equitable health care. He writes, "How we spend our attention really matters because we are much more likely to solve the problems we pay attention to." He critiques the global health system's neglect of TB, exacerbated by recent U.S. policies, like the CDC's gutting and USAID's closure under Trump, which he calls absolutely devastating to human health. Green also connects TB to broader crises, like climate change, noting both disproportionately harm the poor due to resource misallocation. His advocacy extends beyond the book. Green's Nerdfighters raised over $30 million for maternal health in Sierra Leone, and he lobbied the UN in 2023 for TB solutions. The book is a call to action, urging readers to donate, contact lawmakers, or challenge pharma greed. However, critics like Rebecca Robbins note Green's vagueness in assigning blame, avoiding specific culprits beyond systemic issues. Reviewers praise the book's accessibility and emotional depth, but highlight flaws. The AV Club argues it's too short, distilling rich research into brief chapters, and finds Henry's anecdotes repetitive, disrupting historical sections. The New York Times notes Green's frustratingly vague blame assignment, wanting more specificity on who perpetuates TB's persistence. Library Journal calls it scattered, lacking depth for medical or sociological experts. Green acknowledges TB's mysteries, like why some develop active disease, admitting, even though we've known the cause of tuberculosis for 140 years, there are still many mysteries about the disease. Everything Is Tuberculosis debuted as a #1 New York Times, Washington Post, and indie bestseller, lauded for its intelligence, wit, and tragedy. The Associated Press calls it weirdly touching and super quotable, while Slate deems it a quintessential John Green book grappling with mortality and humanity's contradictions. Kirkus Reviews gave it a starred review, calling it a highly readable call to action. However, its timeliness, amid U.S. health funding cuts and a Kansas TB outbreak, amplifies its urgency and tragedy. Green laments, "I would give anything for my book to be less timely." Everything Is Tuberculosis is a poignant, accessible exploration of a curable disease that kills millions due to human neglect. Through Henry's story, Green humanizes TB's toll, weaving it with a history of romanticization, racial bias, and systemic failure. He argues, disease thrives in areas decimated by social and political neglect or disregard, and all contemporary TB epidemics are the result of human systems. Yet he offers hope, emphasizing that we have the power and knowledge and capacity to eradicate the inhumanity that is found at the source of all contemporary TB cases. The book challenges readers to care about a disease that walks the trails of injustice and inequity we blazed for it, making it a vital contribution to global health discourse.